Patients planning either a cosmetic or reconstructive surgery will often ask, how can I reduce the appearance of scarring after surgery? Well, any surgery that you have is going to result in a scar because when we reshape, we trade scars for contour. But we can do some things to reduce the appearance of scarring as we heal. One of the most important things to reduce the scarring after healing is to reduce the source of irritation to that scar. Irritation to the scar can be either a topical irritation like sunburn or sun exposure, or bacterial contamination of an incision, such as infection, or tension on that scar, such as pulling on the scar. So here are some things we can do that definitely improve the appearance of scarring after surgery. You can use a product such as Embrace to help support the scar. Embrace is a sticky silicone sheet that's been designed to be placed onto the scar, and it's placed every 2 weeks. It lasts about 10 days. It's a sticky silicone sheet that helps support the scar so that the scar doesn't pull apart when you have movement of your body or tension on that scar. For example, in a tummy tuck scar, when you place a sheet of Embrace or along an inframammary fold after a breast reduction or an augmentation, and you have an area where the body pulls perpendicularly to that scar and might stretch that scar out while it's early and weak in the healing process. Because anywhere that you have a scar, it's weaker than the surrounding tissue. You see, a scar is only 70% as strong as its surrounding tissue because it's like a stretch mark or a fracture in the skin. Scar tissue is never as strong as its surrounding skin. It's about 70% the strength of the surrounding tissue. So when you have a scar, it acts like a stretch mark. It's a fracture, an opportunity for the tissue to stretch. So if there are lines of tension perpendicular to that tissue, such as a fold scar after a breast reduction or a tummy tuck scar where the skin's been placed tight, that skin can stretch and create a wide scar. A product such as Embrace is a silicone strip or a sticky silicone pad that's placed over the scar that helps support that scar. I think of it like a cast after you've broken your leg. The bone is healing and you place a cast to support and reduce the tension along the bone where the bone is healing. But when you have a scar along the skin, you can place Embrace along that scar to reduce the shearing forces and the tension forces along that scar. A ghetto version of Embrace is a use of a silicone tape, such as the 3M silicone tape, and that can be placed along the scar to reduce the tension along the scar. There are also topical silicone treatments, such as silicone gel, which have been shown in studies to reduce the appearance of scarring, whether it's that silicone reduces the free radical irritation of oxygen along the scar, or it's that the application of silicone oil and ointments along the scar creates a massage motion that breaks up the formation of scarring, or that silicone ointment moisturizes the scar, creating less irritation. Whatever the cause, silicone topical ointments do reduce the appearance of scar. Sunblocks, such as Neutrogena's sunblock with titanium and zinc oxide, elemental sunblock creams and ointments that contain titanium and zinc, do block the sun's exposure, reducing the irritation and damage to that fragile, healing scar tissue. Because healing scars are like a baby's skin, very fragile. And if a healing scar is exposed to sun, it can cause irregular pigmentation, darkening or thickening of the scars, which can be unsightly. So if you've had a breast surgery or a tummy surgery and are planning to wear a bathing suit, it's important to place thick and heavy lifeguard type sunblocks even under your bathing suit, because the sun will make it through your bathing suit and will burn or damage those scars early in the healing process. I recommend that for 1 year after surgery, you should use a heavy sunblock even under your bathing suit if you're planning a day in the sun. So in summary, the most important things you can do to reduce the appearance of scarring after cosmetic surgery are to have a healthy diet and a healthy body shape, to have a surgeon who designs a cosmetic surgery in which you have minimal tension on your scars, to use silicone ointments, silicone gels, and there are multiple products such as this on the market, in order to help support the healing of that tissue, to use an embrace type scar therapy or 3M silicone tape along your incisions to help support that healing, and finally to use sunblock containing zinc and titanium to help reduce the exposure to sun in the 1 year time period following your cosmetic surgery.